we are going to measure the hip joint flexion. So to measure hip joint flexion, first we will ask patient to, so we will only do passively, we will do hip joint flexion once, one time, two times. While doing flexion, I am trying to palpate greater trochanter. So now here I confirm that here patient is having greater trochanter. We have to take, after that first we have to keep our fulcrum over the greater trochanter. See, fulcrum over the greater trochanter is our stable arm. Stable arm will keep over lateral to the body, and then movable arm will be lateral to the thigh. Now we will ask patient to go for flexion. While patient is going for flexion, movable arm will move with the patient flexion. So now flex. This is the flexion range. This is the flexion range. So this is flexion. Once do extension. While patient is doing extension, here we have to palpate the greater trochanter. After, again here fulcrum, we are going to take fulcrum as our greater trochanter as our fulcrum. Then this is our stable arm, like how we kept for hip joint flexion. This is our mobile arm and keeping lateral to the thigh. Now I will ask patient to do extension. What is it? End range. So relax, relax. So while patient is doing extension, how much mobile arm will move with patient thigh? So that is the range of patient extension. Okay, here come to super. Now we will see hip joint abduction. Hip joint abduction. We know the movement hip joint abduction. Abduction means it's nothing but away from the body. This is hip joint abduction. So to measure this, we are going to take ASIS as the fulcrum. So this is patient ASIS. This is patient ASIS. Will take it as fulcrum. So I am taking ASIS as fulcrum. Is ASIS. Then stable arm I am keeping parallel to the C. Here we will be having ASIS. This stable arm is going to touch the one more ASIS. In that way we will keep. Then this the mobile arm will keep on the front of the thigh. Otherwise middle of the front of thigh. So then we will ask patient. Then see, relax, relax here. Then we will ask patient to, and then come that side. Just hold it. Here also. Just just enough. Now here we will ask patient to do abduction. We will ask patient to do abduction. Enough. Relax. Relax. So from 90 degree, how many degrees patient did, that will tell patient ka abduction range. Now we will see hip joint adduction. To measure this side hip joint adduction, we are going to take this hip joint into abduction. This hip joint into abduction. Now we will keep this lower limb in neutral position. This lower limb in neutral position. To measure the adduction, again same. I am taking ASIS as the fulcrum. ASIS as the fulcrum. So here ASIS I will keep fulcrum, and this is a stable arm. I am keeping here stable arm. This is our mobile arm. Now I am going to do the adduction movement. Now I am going to do the adduction movement. So the range from 90 degree, how much it came, this will tell us adduction of this patient hip joint.
Join the internal rotation and external rotation. For that we make a patient to sit in high sitting position, and we'll just check for the internal rotation and external rotation. This is the internal rotation and this is the external rotation. And with the help of goniometer, we are going to check the internal rotation and external rotation. So the fulcrum will be placed on the anterior aspect of patella on mid, and the movable arm. So movable arm will be parallel to the tibia, and the immovable arm will be parallel to the movable arm. And so we'll check for the, first we'll check for the external rotation. This will be the external rotation of the patient. And neutral. And we'll check for the internal rotation. And this will be the internal rotation of the patient.
One more method. So this is little easy compared to that one. So second method to measure hip joint internal external rotation. So in this method we have to first flex the knee joint 90 degrees. So here we can do, what is this rotation?
External rotation.
This is internal rotation. External rotation and internal rotation. So we'll ask patient to keep this position. Then we are going to do measurement. We are going to do measurement. See here, first fulcrum as our first method, it will come over the midpoint of the anterior patella, midpoint of the patella. So here mobilum and stabilium will be on same place. Mobilum, stabilium will be on same place. Now I'll ask patient to do rotation. What is this rotation?
External.
So when patient do external rotation, then I'll keep mobilum straight to the mean, parallel to the tibia. So now I can tell this is the patient external rotation. Now we will see internal rotation. This is internal rotation. Placement of the fulcrum same as external rotation. Now I'll ask patient to do internal rotation. Once the movement is done, then I am going to keep it parallel to the tibia. Then I will tell this is the internal range of the patient.